Welcome to the benefits of glutathione for your health and life. My name is Mark Huber, and I'd like to ask you a question. How would you like to get your hands on a naturally occurring substance that acts as an antioxidant, an immune system booster, and a detoxifier? Would you be interested in something that can help your body repair damage caused by stress or pollution, radiation, infection, drugs, poor diet, aging, injury, trauma, and burns? Well, if you answered yes, like me, then you need to check out something called glutathione. So what exactly is glutathione and where do you get it? Well, glutathione is actually a very small molecule that's produced by the body and found in every cell. It is the body's most important antioxidant because it's within the cell. And so what is an antioxidant? Well, this is the term given to those things that cause good health because they neutralize free radicals, which build up in cells and cause damage. Now, because glutathione exists within the cells, it is in a prime position to neutralize free radicals. It also has potentially widespread health benefits because it can be found in all types of cells, including the cells of the immune system, whose job it is to fight disease. So what does glutathione do? Well, the strong antioxidant effect of glutathione helps keep cells running smoothly. It also helps the liver remove chemicals that are foreign to the body, such as drugs and pollutants. And there is clear evidence of the important role that glutathione plays in health when looking at studies of people who are severely ill. In fact, when you look at people who have cancer, leukemia, Parkinson's, Alzheimer's, or other very serious diseases, almost invariably they are depleted in glutathione. So how should glutathione be taken? Well, glutathione is not well absorbed into the body when taken orally. So while one can take it intravenously, a more practical solution is to take the precursors. That is, the molecules the body needs to make glutathione, rather than glutathione itself. Taking glutathione precursors will increase the amount of glutathione in the cells. In fact, there is a glutathione enhancing product called Immunocal, which is made up of glutathione precursors, and mainly the amino acid cysteine. So who does glutathione help? Well, studies have demonstrated that glutathione has the potential to fight almost any disease, particularly those associated with aging, since free radical damage is the cause of many of the diseases of old age. Thousands of people have tried glutathione for the treatment of a whole host of conditions, including cancer, high blood pressure, Parkinson's disease, Alzheimer's disease, cataracts, and male infertility, just to name a few. The best studies have been conducted in cancer. One study involved women with ovarian cancer who were treated with chemotherapy. Some of the women were also treated with intravenous glutathione. Now, those given the glutathione not only had fewer side effects from the chemotherapy, but also had better overall survival rates. In 1996, at age 33, Miriam Albayan of Montreal, Canada, had a routine pap smear that revealed she had precancerous cells on her cervix, which is just one step away from having cervical cancer. The 3 specialists she visited all told her that a hysterectomy was her only option, but she hesitated to have such major, life-altering surgery. Instead, she waited, and for more than 2 years her condition remained stable. Then a friend suggested she try Immunocal. After 8 months of taking the supplement, her physician could no longer detect any precancerous cells. Now, does this mean Immunocal cured her? Well, it certainly would be nice to say that it did, but it's hard to say based on just one case like hers, as it is possible her body went into remission naturally. So for all the skeptics out there, let's just say that taking Immunocal certainly didn't hurt her, and may in fact have even helped. And let's face it, to anyone facing a life-threatening disease, anything worth a try. What are the risks? Well, overall, taking glutathione or its precursors in reasonable amounts appears to be quite safe. However, there is some concern about the safety of taking glutathione for the one condition for which there is the greatest evidence of its usefulness, and that is cancer. Now, people don't usually get interested about these health-promoting supplements until they're in their 50s and 60s. At this point, they may already have initial precancerous cells in their body. So, the supplements, just like they promote health in normal tissues, might in fact promote health in the precancerous tissue. Now, while this is a possibility, there is no evidence that supplementing with glutathione, even intravenously, is in any way going to make any cancer worse. In fact, evidence suggests the opposite. It suggests that glutathione and other oxidants, far from interfering with the activity of chemotherapy, appear to reduce the side effects without decreasing efficiency and may, in fact, improve the efficiency of the chemotherapy in fighting cancer. In fact, research has demonstrated that taking Immunocal actually lowers glutathione in cancer cells while increasing it in normal cells, and as a result, the cancer cells are more vulnerable to chemotherapy and the normal cells are protected. So the upshot? Well, you guessed it. The experts disagree on who should take glutathione or its precursors. Dr. Gustavo Bonas, retired professor of surgery at McGill University in Montreal, director of research and development with Immunotech, the manufacturer of Immunocal, says everyone should take it in order to optimize overall health. Dr. Appleton, chairman of the Department of Nutrition at the Natural College of Naturopathic Medicine in Portland, Oregon, and senior science editor for Health Notes, would reserve it for people with cancer. Dr. Dean Jones, professor of biochemistry and director of nutritional health sciences at Emory University in Atlanta, says it might only prove beneficial for those who eat poorly and are thus unlikely to get much glutathione or its precursors in their diet. For her part, Miriam Abelaine is still taking Immunocal and feeling fine. "I'm doing pretty good right now," she says. "I'm in better shape than ever." If you would like to hear more of the glutathione story and explore if taking glutathione would be beneficial for you, please feel free to visit us at theglutathionestory.com or connect with us by calling our toll-free number at 1-888-923-9133. My name is Mark Huber, wishing all the very best to you and your health.